Thank you very much, Chairman, for that introduction. The political leader of the United National Congress, the Honorable Kamala Prasad Bisesa, fellow speakers, parliamentary and NATICS colleagues, local government councillors, the many of you viewing on and listening on the various platforms here tonight, members of the media, a very good evening all. There are so many issues to talk about in the health sector, but tonight I will touch on a few matters that should concern all of us. Ladies and gentlemen, while it appears that the COVID-19 pandemic is slowing down, it is too early to throw caution to the wind. We in the opposition will continue to monitor this government's response as the country starts to reopen, and we have no problem with the country reopening. It is time for that, but I'm saying that we have to be cautious and we have to keep an eye. We will hold them to account in the health sector, in the socio-economic space, and in all the other relevant sectors. It is obvious that this government has again fallen down on its vaccine procurement process. And my colleague Arnold Ram spoke earlier about the lack of preparation in terms of the reopening of schools. And I just want to make the point that again, we are seeing a fall down in the procurement of vaccines, this time for the age 5 to 11 group. The Minister of Education announced at a press conference last week that all schools will reopen on Tuesday, April 19. We have no issue with that. We are happy that children who have suffered for so long will now be able to return to school in a few weeks. However, some parents are fearful that their children, of their children being exposed to COVID-19, and therefore would have liked their children to be vaccinated before they return to school. And again, while this might be a matter of choice, it is also important and critical to understand that some children might be at risk. Some children might be asthmatic. They may have certain conditions that will make them immunocompromised. And therefore, these parents have a legitimate right to expect the vaccination. Unfortunately, this government is yet to provide the Pfizer vaccines for this age group. And we know that this vaccine has been approved by the WHO since January of this year. In answer to questions, and we have been raising this in the Parliament over the last few months, the Minister of Health indicated that the negotiations with Pfizer, there were negotiations with Pfizer by the government. Apparently that has fallen down. We wonder why. And we are told at the last sitting of Parliament that 40,000 doses of vaccine are expected as a gift from Spain. We are grateful for that. That will provide it's a 2-dose vaccine that will provide for 20,000 children, but we are yet to be given a date for the arrival of those vaccines. So again, many parents will be disappointed. They will feel that they've been let down by the government, and they would have thought that during this time that they're waiting, this 2 weeks, that their children would have received the first dose of the vaccine. But no such luck with this government. Instead, it's only excuse after excuse for their non-performance. In fact, the situation is so bad that I'm told that some parents have opted to take their children abroad to get the vaccine. But that is a few. What about the many who cannot afford this? So we call upon the government to make these vaccines available as soon as possible to ensure the maximum protection for those children whose parents want it. I now move on to look at some of the findings of the COVID-19 report. The report of the Committee on the Management of COVID-19 has revealed that the government fell short in several areas, contrary to the rosy picture that the Prime Minister and the Minister of Health tried to paint at their numerous press conferences over the past 2 years. Ladies and gentlemen, you're very familiar with what has been happening at those press conferences. I want to say at the outset that this report was done by a group of professionals well respected in their relevant areas of expertise. This team, however, encountered many challenges in their work, including time constraints and lack of access to critical data. And many of those limitations are outlined in the report. Unlike a commission of inquiry, and this is important since the Honorable Leader of the Opposition had called for a commission of inquiry, unlike a commission of inquiry which has powers, this committee had no powers to summon witnesses or to access documents. And therefore, they had to rely on the goodwill of stakeholders to provide data and information. But to their credit, the team produced a fairly comprehensive report. And in fact, it is a damning indictment on the poor performance of the Shirauli government in the COVID-19 pandemic. The report showed that while the hard-working teams of doctors, nurses, and other frontline healthcare workers did what was required of them, they kept their portion of the bargain, but the government failed to provide the required support in many areas. The report tells the story of a healthcare system unprepared to deal with the surges that took so many lives. The report tells the story of a healthcare system unprepared to collect critical data. And let me give you an example. In the report is listed place of death. At the time of this report, the committee had examined 3,200, just over 3,200 deaths. And I quote from the report, "It is important to highlight the large number of deaths that were included in the category described as other, that is 633 cases, which amounts to 19.3% of all deaths. This made it difficult to interpret results related to the place of death. You know, in this report, ladies and gentlemen, there's a table that tells you where patients died. But imagine they cannot account for 633 deaths where these patients died. You know, when I look at some of the findings of this report, it's frightening, it's worrisome. I had to read this report 3 times to ensure that I was reading right. That was one of the issues. More than this, very worrisome. And if we look at recommendation 12, and I quote again carefully from the report, I quote, "Data on hospital deaths provided to us did not allow us to discern where death occurred in the hospital, whether in the tents, which are also called the biocontainment units, the A&E, the wards, the ICU, or in a step-down facility." Now that is frightening. And many of us, many of you, would have had situations where friends, family, relatives, and so on were not able to locate, where your relative was, not even the hospital sometimes. And now we are finding that even in the particular hospital, we couldn't account for which part of the system these deaths occurred. So indeed, it is a very, very worrisome situation. So level of care, and again I quote, "When the level of care was examined, it was found that most patients were admitted to wards. Unfortunately, there was no data to determine how many needed a higher level of care during their hospitalization or even their duration of stay." So a lot of findings in this report, and yet this was a government that told us that they were following the science, when in fact such basic yet critical data was not available to guide decisions. So we wonder what was happening all along. This report also tells the story of a healthcare system which was inadequately resourced, despite the government having spent millions on its COVID-19 response. In fact, a report in the Express of December 4th, 2021, revealed that the sum of $518.4 million had already been spent on the health sector response. This is the health sector response to COVID-19 for the period March 2020, the beginning of the pandemic, up to September 2021. So of course, a lot more would have been spent subsequent to that. And yet the report raises concerns of inadequate resources in terms of both of critical drugs and human resources. I want to ask here tonight, and again I base all of these on the facts contained in this report, did the government shortchange some critically ill patients by not purchasing enough of a drug called tocilizumab? It's an important drug, and let me tell you, let me quote again from the report. This is the report saying this. This is not Dr. Bodoe saying this. And I quote, "Most staff were very impressed by its effects." They're speaking about this drug. "And perhaps C40 is the government procuring agency and storage, and perhaps C40 needs to increase purchasing of this drug. Though it is an expensive drug, there is a cost benefit to be realized from its use. We recommend that the policy regarding tocilizumab use be reviewed." So the committee is saying that, listen, it might be an expensive drug, but it is worth investing in the drug so that you could save lives. At the end of the day, this is what the health sector is all about, is to look after and to care for your people. And again, this is where the government has fell down. So I ask here tonight, has this policy been reviewed? Is this potentially life-saving drug now more readily available for all those who need it, or does it still have to be rationed? So I ask these questions here tonight. Another issue was the availability of supplies from C40. We mentioned that this is the main storage area for drugs and supplies. And, you know, it is sad when I saw this recommendation. Recommendation 4 in this report says, the frontline staff need 24 hours per day, 365 days support during the pandemic. We recommend that C40 should be continuously open 7 days a week. You know, so they're saying this, you're dealing with a pandemic, and yet you have a situation where your storage for drugs and supplies is not available to the doctors and nurses who need it 24/7, 365 days. I mean, this is poor. So imagine a simple but critical administrative arrangement like this could not be put in place by this government. So in addition to the shortage of critical drugs, the report also alludes to a shortage of nursing personnel, both on the wards and in the ICU, HTU. And again, this is frightening. And again, many of you would have, have relatives or neighbors who would have spoken of this. And I quote, some reports speak of 1 nurse to 20 to 30 patients. This sort of staffing ratio would point to decreased levels of care. So you have a situation here where you are trying to treat with COVID, and you have 1 nurse having to look after 20 or 30 patients. Can that nurse really be able to pick up when one of those patients deteriorate? You know, I think the authors of this report have been very kind and diplomatic in terms of the kind of language they've used, to treat with some of the atrocities that we saw in this report. It also speaks of 1 nurse in a COVID-19 ICU nursing 6 patients, and of shortages of attendants on orderlies to turn patients. And this is important because in the ICU setting, the international standard, even the standard that the Ministry of Health has set for itself, speaks to 1 nurse in an ICU looking after 1 or 2 patients at max. And here we are saying that they had to look after 6 patients. And therefore one can wonder, and the question has been asked often, is this one of the reasons why the ICU mortality rate was so high at the peak of the pandemic? And in fact, the data was so limited that the committee could not give us a figure, could not determine that rate. So we see that there are many issues, and I want to personally, and on behalf of the opposition, commend these nurses and other members of the frontline teams for their dedication to service under such trying conditions. When one reads what they had to do and how they had to do it with the limited resources and support of this, and lack of support of this government, they are indeed and truly heroes. And I join the call of others for these dedicated patriots to be adequately compensated when the time comes. So, ladies and gentlemen, the findings in this report is a serious indictment on the performance of this government in managing the COVID-19 pandemic. Ladies and gentlemen, if anything, this is what Minister Dayal Singh should be shedding tears for, the findings of this report, ladies and gentlemen. So instead of boasting every other day at press conferences about the so-called parallel healthcare system, he should have been on the ground finding out what was really happening and trying to fix it. There is a whole more lot to say about this report, but time does not permit tonight. And we'll come back and treat with those other findings subsequently. As we move out of this pandemic that we are now facing, I would just want to speak about another epidemic that is going to face us, and this is a chronic disease burden. So what does this mean? It means that it speaks to the difficulties faced by patients with chronic diseases, such as diabetes, hypertension, heart disease, renal disease, and so on, and their ability or inability to access timely care. So what we had was a scenario where all the resources allegedly being diverted to COVID, and the government said that they had a parallel healthcare system. So the population assumed that you had the parallel healthcare system with COVID, treating with COVID patients. So what happened to the regular healthcare system? And of course, it wasn't truly a parallel healthcare system, because what happened is that the same staff from the regular healthcare system were deployed to work in the parallel healthcare system. And as a result, patients suffered. These patients suffered, and now we are going to face this burden of the backlog of those patients who need their treatment for diabetes, for heart disease, for cancer, and so on. In fact, they've also created a waiting list for surgery because of the backlog. The anesthetists who had to be present for surgery in the San Fernando Hospital, for example, were deployed to the Augustus Long and the Point Fortin hospitals. So what do we suggest? Because the waiting list for some of these procedures is now close to 1 year. So we suggest that more staff be employed to ease the backlog of patients in the chronic disease clinic. These doctors who have been given 1-month contracts, they need to be re-engaged into the system and help to deal with this backlog. We need to revisit the extended hours at the health centers. Under the leadership of then Prime Minister Kamala Persad-Bissessar, her vision was to increase and extend the opening hours, and that was done at 44 out of 100 health centers in Trinidad and Tobago. And therefore, the time has come now for this government to revisit that so that you have more access, more time for these patients to be treated. Under the former Prime Minister's leadership, we also had something called the Extended Patient Program that allowed an avenue for this backlog to be treated. And therefore, the government needs to look at some of these avenues to treat with this. Another area of concern for us in the opposition is what is the proposed use for the Couva and Augustus Long hospitals when they are no longer required as COVID-19 facilities. The government, as part of the decommissioning of COVID facilities, has restored normal services at the Point Fortin Hospital. We are happy, we are grateful, and I'm sure that the people of Point Fortin are happy as well. And they also have announced the same for the Arima Hospital in the near future. So we are asking, to what use will the state-of-the-art, now proven 230-bed Couva Hospital be put? So there's no longer any excuse. They can't say it's a construction site. So I am saying, and the opposition is saying, will it finally be used to benefit citizens as a regular hospital, or will they find some other reason to close it again? And I warn the government that the population of Trinidad and Tobago is looking on with interest as to what use this hospital will be put to. The 50-bed Augustus Long Hospital now has its own state-of-the-art ICU facility, and it can be a very valuable asset for the public healthcare system. The question is, will it remain under the purview of the SWRHA as it is currently, to be used for public citizens, or will it go into the hands of friends and financiers of the PNM to be run as a private hospital? So we put the government on notice that, we in the opposition will keep a very close eye on this. There are many, many other issues, ladies and gentlemen, but I just wanted to mention that this is a government that has its priorities all mixed up, and especially so in the health sector. Let me give you an example. Today's newspaper speaks of a mother who had to raise $62,000 to save the hearing of a young child. She had to take the child abroad to the Dominican Republic. Very unfortunate. But yesterday's newspaper, ironically, spoke of a report of some $37 million being paid to attorneys representing the RHAs in legal matters. I will say no more about this issue at this point in time. So, ladies and gentlemen, as I close, brothers and sisters, I want to say to you tonight, stay strong and remain focused. Under the strong and visionary leadership of Kamala Persad-Bissessar, we will continue to fight for you inside the Parliament and outside